And just to show you the misinformation that's going on. This is Congressman Cassidy. He was on C-SPAN talking about healthcare, and he comes up with this amazing statement, and he says Medicaid patients have worse outcomes than those who have no insurance. So you have to let's be clear about what is being said here. If you have no insurance at all, and you are just paying for it or foregoing care, you have a worse outcome than than if you're on a government plan. Let's take a listen.
You said the quality of care is below average.
Yes.
Why?
Well, that is not, it's documented, but the reasons why are not entirely understood. But there's a recent report that showed that those on Medicaid had worse outcomes than patients with commercial insurance. Patients who are on Medicare, the federal program, remember Medicaid, for your viewers who may not know this, is a combined federal-state program that insures, so to speak, the low-income folk. And it's actually worse than the uninsured. So Medicaid patients in some cases have worse outcomes than patients.
By the way, I know C-SPAN's trying to do a good job. I get what C-SPAN's doing. They don't want to be partisan. They want to let people say their piece. But not even a question of, well, really, what report is that? Medicaid patients do worse than people with absolutely no insurance? Tell me about that report. And if you can actually tell, Mr. Congressman, if you can tell me about what report that is, tell me who funded it. Because I would venture to say at least half of these reports that we hear about have the results are we already know what the results will be before the report is even done because we know who's funding it. Not even mentioned. Not even mentioned. And also, Congressman Cassidy, absolutely no examples. The one thing that is true, and we have to think about it, and this is completely apolitical, this is about people's lives, is that the Medicaid population generally has more risk factors in their health care, and they are in need of more coverage. So even if, we're completely taking this apart, right? I mean, we don't know what study he's referring to. If we had a study, we need to figure out who paid for it. Let's assume he's right. We have to be aware of who is getting Medicaid and then who is going without any insurance at all, right? If we look at the Medicaid, what would we call it? Constituency, high diabetes, number of other risk factors versus many people are uninsured. But among those, for example, healthy college students who are choosing to go without insurance, yeah, if you're going to look at how they're doing health-wise, the poor population on Medicaid with diabetes is going to do worse. So please, ladies and gentlemen, I know that it is difficult to do this because you hear this and then it's repeated and then it becomes the de facto point of reference. Question what is being said. Medicaid patients have worse outcomes than those with no insurance. So therefore what, Congressman Cassidy? We should keep the for-profit, corrupt healthcare system that we have? That's what you draw from this study that you can't even name? I think people aren't asking enough questions, Lewis.
Well, we know that. It's unfortunate.
Unfortunate. Lewis is the king of the understatement at this point, ladies and gentlemen.
Well, you sum things up pretty nicely.
Again, think about the GOP focus since coming into office. And we criticize. I am progressive. I admit that. On the show, when we come to what are the options on social issues, I come down on the progressive side. But this is not about party. This is about what is the truth. This is about holding people accountable. And this is about holding corporations accountable and the government and elected officials. Let's not be swayed by made-up information. Let's not be swayed by 12 attempts to repeal Obama health insurance reform into thinking that that is the valid discussion we should be having.
What's amazing is that the only time they talk about the things they talked about on the campaign trails is when they're doing big interviews.
And even then, Lewis, you know that corporate media barely really wants... You may get a question. You won't get a follow-up. You won't get debate. Absolutely not. But you're right. That's the only time there's even... At least corporate media is feigning any concern over what was promised. It's more than can be said for what's happening on the floor of the House.